Did you know that 70% of medical decisions are supported through results provided by laboratories and pathology services? Behind every test is a patient, and behind every patient is a story where laboratories are able to assist in providing hope and healing. So Karen, thanks for joining me today. I understand that there was a recent patient case involving a rare histiocytic disorder where you and the team really had an amazing impact on their care. So just hoping you could tell me a little bit more about that particular case.
Yeah, it's a great story. This was a 28-year-old woman from New York. She started having symptoms of double vision and then some trouble with her balance. And so she went to see a couple neurologists. They thought she had MS initially. Then she went to another neurologist and he diagnosed her with clippers. She was treated with steroids, and that's supposed to respond very well to steroids, but she didn't respond. And I think it was her mom, who was a nurse, started Googling clippers and she found Dr. Oliver Tobin, who's a neurologist here at Mayo. Dr. Tobin, looking at her imaging, was right away suspect that this was not clippers, but was in fact a histiocytic disorder called Erdheim-Chester disease. With the suspicion of this disorder, he ordered the vertex to toes, the complete PET scan, saw the characteristic lesions in the bone around the leg, but we still needed a biopsy to confirm. So that's where I come in because I'm a hematopathologist. In Erdheim-Chester disease, about 10 years ago, they discovered that there are recurrent mutations and they involve the MAP kinase pathway. And so identification of that mutation is very important to confirm the diagnosis. And that's what happened with this patient. We identified a genetic alteration in the BRAF gene. She got a targeted therapy directed against that mutated protein, and she's shown remarkable improvement.
Cody, thanks for joining me. One of our consultants and hematopathologist, Dr. Karen Rech, touched base with us about a really interesting patient story involving an innovative test. And I understand that as a developer, this was actually a test that you've worked on. Can you talk a bit about this novel assay for this rare disorder?
Mm-hmm. Fortunately, at Mayo Clinic, we have an outstanding team of developers, hematopathologists like Dr. Rech. We have genetic counselors, bioinformaticians, and all kinds of other specialists who can collaborate. So when Dr. Rech, approached us about 2 or 3 years ago, asking if we could have a genetic test for histiocytic neoplasms, we, got the team together, so to speak, and went to work, right?
Yeah.
This new test, it uses a technology called next generation sequencing. It allows us to sequence or analyze multiple genes at once, from a single patient or from a single sample at a very high throughput level. And we're actually profiling 8 genes that are known to be commonly involved in this group of disorders called histiocytic neoplasms, which includes Erdheim-Chester disease. The test goes through a very rigorous test verification or validation process. Really, the ultimate goal there is just to show that we have the best test possible and we're providing the best results for our patients.
So how does it make you feel as a developer to know that a test that you're working on and developing is going to impact the life of a patient who's coming here probably very scared, uncertain about the future, maybe having lost some hope? Like, what does that mean for you as a Mayo Clinic and DLMP employee?
Yeah, it's amazing, right? When I see stories like this, it really reminds me that, this is more than a job, right? I'm actually creating something to help a patient somewhere find answers. And that's what really, motivates me.
What you're doing, so critically important. So thanks for taking the time today, Cody, to talk with me.
Yeah, absolutely. Thank you.
So next generation sequencing to identify a subset of mutations, and if one of those mutations is present, now it sounds like some FDA-approved therapies that can be used to target the specific variant or mutations to help patients respond.
Yeah.
That's amazing.
And these patients respond very well, and it changes their life. I went into medicine because I wanted to help patients, and as a pathologist sitting behind a microscope, you don't have a lot of that personal connection with the patients. So to hear that something that you did, that you worked hard on, contributed and had such a positive impact just feels really good.